Okay? Atlas is named by that because Atlas is the god that held up the world, right? So the Atlas, and these are the occipital condyles here, or actually the superior articular process that articulates with the occiput. Okay? So the occiput's sitting right here, like this. So then you're going from here, like I said, this dips in right there. And then you go a little farther down, and you'll feel that C2 spinous process. So you won't feel, that's the back of the rim of the occiput. I mean, I'm sorry, of C1, which is the atlas. And then here, again, these are the transverse process. See here, they're going to be a little bit forward of halfway to the side of the neck, and they're going to be more bony, and they're going to be tender to the touch. And then this will do, we have tables, but basically you come down along the thoracic spine and you're going to feel for the transverse process. You go from the spinous process a little bit out and you feel the tips of these transverse process that articulate with the ribs. And then in between the spinous process and the transverse, that's going to be a mass of muscles in there. And like I said, on these, on the back part, you have the, is it UB, right? You have the back shoe points. Those are going to be on the, there's two different rows, right? So that's going to be basically in all the meat of this muscle here. And so, we'll be talking about all the muscles of the back at one point, and we'll go into all of those. So there's the different rows, and then you want to be able to know the landmarks because different levels, like L3 is back shoe for with the ovaries. Anyway, there's different organs. There's a whole bunch of organs that are on those back shoe points, and then they're corresponding to different vertebral levels and things like that. All right, so then now you have this ridge on the front of the rib cage. You have the xiphoid process, right? And then you have the ridge of where the cartilage goes here. So you can just follow that down, right? And when you reach underneath there, that's where the diaphragm attaches. The diaphragm is a big dome that hooks around the edge of the inside of the ribs here. Right? And then if you follow that down, you'll get to where if you come around, like you can feel where the floating ribs are, where they're not going into the cartilage. And then if you follow back around, then that's when you get into the floating ribs. And then you can palpate between the ribs. There's the muscle in between, right? And then one of the other things that we'll talk about in this class as much as possible is that certain points where you have to be careful when you're doing needling. Obviously, this is one of them here. You don't want to be going into the lungs, puncture a lung. Not a good thing. So you want to be able to palpate and feel, okay, here's a rib, here's not a rib. So that's where the muscle tissue is in between. And then again, there's the floating ribs. You can feel them in the back there. Right? And just that's it.